Καλησπέρα σε όλους. Hello. It's great pleasure to meet you, to have you here, Dr. Maisel. Welcome to the masterclass, Anxious Clients and What to Do to Help Them. Before we proceed to the presentation, let me say a few words about myself, and then we will present Dr. Maisel. And we will proceed to his presentation. I'm a psychologist and I work with children with neurodevelopmental disorders and their families in the public sector. And I'm also academic director of two master programs at the Gian Omeros College. I'm academic director of school psychology and neuropsychology with cognitive neuroscience. And if it's okay with you, Dr. Maisel, I will introduce you to our audience using your CV in the Greek version. And as soon as I finish, we can then proceed with your presentation. Ο Eric Maisel είναι coach δημιουργικότητας, ενεργεία, οικογενειακός σύμβουλος και συγγραφέας περισσότερων από 50 βιβλία. Το 2020 κυκλοφόρησε τα βιβλία Unleashing the Artist Within, The Creativity Workbook for Coaches and Creatives, Lighting the Way and the Power of Daily Practice. Το 2021 κυκλοφόρησε το περιοδικό Transformational Journaling for Coaches, Therapists and Clients, σε συνεργασία με τη Linda Mock και το Redesign Your Mind. Το 2022 θα κυκλοφορήσει το The Great Book of Journaling σε συνεργασία με τη Linda Mock και το βιβλίο Wise Martin's Heart. Ο Dr. Maisel είναι επίσης ο επικεφαλής συντάκτης των Ethics International Press Critical Psychology και Critical Psychiatry, ενώ το 2022 θα κυκλοφορήσουν οι δύο πρώτοι τόμοι της σειράς Critiquing the Psychiatric Model and the Humane Alternatives to the Psychiatric Model. Ο Dr. Maisel, εμπνευστής της φιλοσοφίας ζωής, γνωστής ως κηρισμός, θεωρείται ο σπουδαιότερος creativity coach της Αμερικής και έχει ασχοληθεί εκτενώς με τις προκλήσεις της δημιουργικής ζωής. Τα βιβλία του σε αυτόν τον τομέα περιλαμβάνουν τα παρακάτω, Ατρόμητη δημιουργία, Fearless Creating, Καθοδήγηση του εσωτερικού καλλιτέχνη, Coaching the Artist Within, Δημιουργική ανάκαμψη, Creative Recovery, Van Gogh Blues, και τι θα σέβονται στο δημιουργικό άγχος, Mastering Creative Anxiety. Τα βιβλία του που απευθύνονται σε συγγραφείς περιλαμβάνουν τα παρακάτω Deep Writing, Right Mind, Living the Writer's Life, A Writer's Space, A Writer's Paris και άλλα. Ο Dr. Maisel γράφει εκτενώς για θέματα ψυχιατρικής, όπου θεωρείται ηγέτης σκέψης και υπέρμαχος σημαντικών αλλαγών στα πρότυπα και τις πρακτικές ψυχικής υγείας. Τα βιβλία του σε αυτόν τον τομέα περιλαμβάνουν επανεξέταση της κατάθλιψης, το μέλλον της ψυχικής υγείας και ανθρώπινη βοήθεια. Μεταξύ των άλλων βιβλίων του για επαγγελματίας ψυχικής υγείας είναι και τα βοηθώντας τους γονείς των διαγνωσμένων και διαφορετικών παιδιών. 60 καινοτόμες γνωστικές στρατηγικές για το φωτεινό, ευαίσθητο και δημιουργικό και βοηθώντας επιζώντες αυταρχικών γονέων, αδελφών και συντρόφων, όλα από τον εκδοτικό οίκο Routledge. Ο Dr. Maisel γράφει για τον blog επανεξετάζοντας την ψυχική υγεία του Psychology Today με πάνω από 3 εκατομμύρια προβολές για 3 εβδομαδιαία blogs του The Good Men Project και αρκετά τακτικά για το Thrive Global και το Fine Art America. Παρουσιάζει εργαστήρια, διαδικτυακά σεμινάρια, συμπεριλαμβανομένου ενός εργαστηρίου Deep Writing που έχει παρουσιάσει σε πόλεις όπως το Λονδίνο, το Παρίσι, τη Νέα Υόρκη, το Σαν Φρανσίσκο, το Δουβλίνο, την Ρώμη και την Πράγα, αλλά και εργαστήρια και κέντρα υποχώρησης όπως το Ισέλεν, το Ινστιτούτο Ωμέγα, το Κρύπαλου, το Hollyhock και το κέντρο The Art of Living Retreat Center. Ο Dr. Maisel ζει στην περιοχή του κόλπου του Σαν Φρανσίσκο, εκπαιδεύει coaches δημιουργικότητας, χρησιμοποιώντας την πρακτική καθοδήγησης και δημιουργικότητας που τον χαρακτηρίζει. Μπορείτε να επισκεφτείτε τον Dr. Maisel στο www.ericmaisel.com, να επικοινωνήσετε μαζί του στο mail ericmaisel@hotmail.com, να εγγραφείτε στο εβδομαδιαίο ενημερωτικό δελτίο του στο ericmaisel.com κάθετος newsletter και να ενημερωθείτε και τις νέες αναρτήσεις στο λογίο του στο authority.com κάθετος Eric Maisel. So, Dr. Eric Maisel, we may proceed to your presentation. Welcome to this last masterclass, and we are all ears to listen what you have to tell us. Thank you very much.
Thank you so much for the introduction and for joining me in the last webinar in the series. Very glad to be here. What we're looking at today is the matter of anxious clients, which means all of our clients, because every single human being gets anxious sometimes more than other times, but it's an experience we all have, anxiety. And even your clients who look very confident may also be quite anxious. You think of someone like a Luciano Pavarotti, who presented to the world as a very confident person, but also had severe performance anxiety. So even if someone looks confident or looks not anxious, he or she may well be quite anxious. So we have to have our strategies for working with anxiety with our clients, because, as I say, all of our clients will be anxious sometimes. First of all, what is anxiety? Anxiety is a natural feature of our early warning system against danger. It alerts us to danger. So it's a good thing we have it. Anxiety is, so to speak, a good thing. Unfortunately, it alerts us to danger when there isn't any particular danger, or when the danger isn't great. So our early warning system against danger works quite imperfectly, and that's why human beings get too anxious too often. And we'll look at this in a moment, we may even have been born with a little extra anxiety. In my model that I talked about in a different one of these webinars of original personality, formed personality, and available personality, extra anxiety may be a feature of our original personality and something that we have to wrestle with our whole life long. So this is a long list of the ways in which anxiety presents itself, how it manifests, how we see it. So please remember when you're working with a client that you may not see anxiety as a certain kind of shaking, let's say, but you may see it in any one of these ways. That your client may be more confused than he or she otherwise might be, or might be struggling with unproductive obsessions, or may look very calm, but it's a strained calmness, a kind of forced calmness that's an overlay over anxious feelings. So the main point of this slide is not really to go through these different ways that anxiety manifests, but just to alert you to the fact that it shows up, anxiety shows up in many different kinds of ways, and you want to be alert to them so that when you're sitting across from someone, you have a good sense of if that person is particularly anxious and how that anxiety is manifesting. And so when a person is anxious, what does he or she do? All of these sorts of things, some of them, so to speak, productive, and some of them, so to speak, unproductive. Among these, so to speak, unproductive ones, if done too frequently, we use alcohol to reduce our experience of anxiety. We take drugs to reduce our experience of anxiety. We try to space out. We binge on television or movies. We try to soothe ourselves to reduce the anxiety. Those are all, let's call them negative ways of dealing with the anxiety. We create strict rules as if we can deal with the anxiety by making sure that our socks are well rolled, or by having all kinds of rules that seem to make us feel safe. And then we do some productive things to deal with our anxiety. Maybe we meditate or exercise. Most people do things to reduce their experience of anxiety that don't really serve them, like drinking too much or soothing themselves too much with substances. That's the typical way that we deal with our anxiety, is in unproductive ways. So in addition to the basic idea that anxiety is a feature of our early warning system against danger, we also want to have a sense of all of the different causes or sources of anxiety, because this gives us a better picture of human nature, a better picture of personality than the current mental disorder model. In the current mental disorder model, it seems as if a person is normal, and then there is the add-on of generalized anxiety or some form of anxiety, that there is a mental disorder add-on that is causeless. The current model is not curious about the causes of something like anxiety. But we, as humane helpers sitting across from someone, we are curious about what's causing the anxiety that our client is demonstrating. So let's just go through some of these quickly, but to give you a sense of the different kinds of causes of anxiety that may be present. First is, as I mentioned, the idea that we may have been born a little more anxious than the next person. Anybody who's had kids knows that each child comes into the world already himself and herself. One child startles more easily than the other child. One child is hard to startle, one child is easy to startle. This is a difference. This is an original personality difference. And that child who is easy to startle as a feature of temperament at birth may be easy to startle her whole life. She may be made anxious her whole life more easily than someone else. And this is something to take into account when we're working with clients, to kind of normalize their anxiety as possibly a feature of original personality, and therefore not as a disorder, but as a lifelong challenge. Our experiences make us anxious. If we live in a war-torn country, if that's the way we grow up, or if we live in a family where there's lots of shouting and anger and bullying, we're naturally going to feel less safe, and we're going to feel naturally more anxious. We don't want to discount the place of experience in the formation of personality and in the formation of reactions like anxiety. The current psychiatric model is not interested in your experiences, as if they don't matter. The current model wants to treat something like anxiety as a plumbing problem, as a problem with your brain, as opposed to a reaction to life experiences. But we know that anxiety is often a reaction to life experiences. Over time, we may have as a feature of our formed personality, we may become an anxious person. Somebody who approaches everything in life more anxiously than she actually would like to. But it's now a feature of personality. It's a reflexive reaction to what goes on. And you can feel how difficult it will be to deal with anxiety if it's now a feature of your formed personality. It's going to be extra difficult to find any anxiety management strategies that work if the anxiety is now built in to your personality. We may not be particularly anxious, but then our current circumstances may make us anxious. something that's going on right now. Maybe it's something about world politics or the pandemic or something in our personal life. Maybe we lose our job or we're having a particularly difficult time in our relationships. Our current circumstances matter. And in working with clients, we need to ask them what's going on right now that may be making you anxious. It's an obvious kind of question to ask, but nevertheless, that question doesn't get asked often enough. If a person has gotten more anxious, it's probably because something's going on in his or her life, and we want to inquire about what that something might be. Because we have life energy, Chinese call it qi, because we have life energy, passion, enthusiasms, appetites, the very act of sitting still can make us anxious because we're bubbling over with energy. It's not exactly anxiety that we're feeling, but we are feeling restless and we're finding it difficult to concentrate. As you know, nowadays, if a child is acting that way, he or she is probably going to get an ADHD diagnosis, going to be labeled as hyperactive or attention deficit disordered. Whereas what's probably going on is that he or she is having trouble sitting still because of an overabundance of energy and is made anxious by trying to sit there. We should not be calling this overabundance of energy a mental disorder. That's not a proper thing for us to be doing. Many of the big life questions that we confront make us anxious. Fear of death, fear of not existing, big questions about how to experience life as meaningful, or how to identify our life purposes, and how to live our life purposes. All of these existential questions can make us anxious and regularly do make us anxious. And they need to be addressed. The questions need to be addressed. The anxiety will be reduced if we can finally, maybe for the first time, identify our life purposes, what's important to us, and then live those life purposes. We're going to reduce our existential anxiety if we are actually living our life purposes. Many people come into the world with a kind of stubborn, inborn individuality. They want to be themselves. And because they want to be themselves, they're not going to follow society's rules, or they're going to regularly dispute society's rules. And society will make itself felt, society will push back on them. And so this oppositional dynamic will grow in some people, this dynamic of wanting to be yourself and the world saying, don't be yourself, be the way we want you to be. And this dynamic, this pull to be free, produces anxiety. It should be obvious that if you're attempting to maintain your individuality in a world that, in a culture, in a family that does not want you to be an individual, that conflict is going to make you anxious. Over time, for many people, their self-confidence gets eroded. I think a baby comes into confident, ready to explore the world, ready to deal with the world, and then that confidence gets eroded by experiences, typically experiences in the family. And so whenever he or she then tries to do something new, anxious feelings arise. because he or she doesn't feel confident enough to pull that off. Whatever it is she's trying to do, she doesn't feel confident enough. So all kinds of self-identifications like I'm not good enough, I'm not strong enough, I'm not equal to the task, all of those cognitions, all of those self-identifications provoke anxiety. If in school and in the family you're told not to have an imagination, to just learn the facts for the tests and draw inside the lines, not outside the lines, then over time we start to have trouble engaging our own imagination. We have trouble being imaginative. And so when we try to be imaginative, because let's say that's part of our job, or because we want to write a novel or paint a painting, the very act of attempting to write that novel or paint that painting makes us anxious because we have prescriptions against imagining. This is very typical for the clients I work with as a creativity coach. For the creative and performing clients I work with, many of them can't understand why they're having trouble trying to write their novel, and it's because they don't really have permission to engage their imagination. And trying to engage their imagination makes them anxious. A 1-year-old can make any mess he or she wants without feeling bad about it. In fact, they enjoy making messes. But we stop being okay with that over time as we're punished for making mistakes and messes, as we're criticized for making mistakes and messes. This becomes so severe over time that I think everyone knows who's listening that the world's #1 phobia is public speaking. We become so afraid of making a little mistake that even the act of presenting ourselves in public for 2 minutes at work, giving a little public presentation, makes us highly anxious because we've become ingrained into believing that it's not okay to make any mistakes or any messes. One of the main considerations in working with creative clients is to help them regain permission to make mistakes and messes, because you can't fully engage with the creative process unless you have deep and real permission to make some mistakes. Again, if you're a creative person or anybody, if you're tasked with doing something and you have a fear that you're not going to do it well, that provokes anxiety. And anybody who works, who has a job, is tasked with doing something that needs to be done well. And if it's not done well, they may even lose their job or may be reprimanded. And all of that experience makes us anxious. Human beings do not like being judged or criticized. So in any situation where we may be judged, an audition, a job interview, or just walking into a family gathering where people are going to look at what we're wearing or whether we've gained any weight, any experience where there is likely to be judgment, or there's the possibility of judgment, will make us anxious. The dark makes us anxious. That's a basic human experience of danger. And going into the unknown makes us anxious. And I think you can see or feel how, if you're a creative person, if you don't have permission to go into the unknown, how can you go do your creative work? Because that's where your creative work exists. It's not known to you yet until it is known. So if you're too anxious to go into the unknown, if you're reluctant to go into the unknown, you can't really be a great researcher, a great scientist, a great anything if you're afraid to go into the unknown. When we had the experiences back then, they made us anxious, but now they still circulate in our system as memories in our body. I'm sure you all know the field called trauma-informed care. That's what we're talking about here, is the ways in which trauma exists in the body. And so even though you are not experiencing the event now, you may be re-experiencing it, and that may make you tremendously anxious. That's at the core of the thing called PTSD. That is re-experiencing experiences and having current negative feelings based on those old experiences. As I mentioned earlier, in a different context, daring to speak makes us anxious. Revealing ourselves makes us anxious. And as a result, people censor themselves. And then they are afraid that their censorship won't work perfectly and they'll let leak out something about themselves, and that will be dangerous. Again, I think you can see how for creative clients, if they are censoring themselves, they can't really do their work. If they don't have permission to tell their truth, at least to themselves, how will they get those paintings made or those novels written? But this is true for everyone. Human beings tend to censor themselves, and that is a dynamic that produces anxiety. The very act of making a choice produces anxiety. This is an important point because we have to make choices all day long. If you're a creative person, every part of the creative process is one choice after another. Should I send my character this way? Should I send my character that way? Should I put a little red on the painting? Should I put a little blue on the painting? These are choices. And choosing provokes anxiety. There have been many interesting social psychological experiments to show the extent to which just the act of choosing heightens anxiety in subjects of the experiments. So think about this. If your client, if the person sitting across from you has to make a big choice, really any choice, but let's say a big choice, whether to leave her job, whether to get a divorce, we must expect that any one of those kinds of choices is going to be making her anxious. And so we're going to be wanting to help her by providing her with some anxiety management strategy or another, and we'll get to those in a moment. Basic survival issues provoke anxiety. Being dependent on another person makes us anxious. Trying to juggle a day job and our creative life makes us anxious. Any kind of survival issue where our, so to speak, life is at stake is naturally going to provoke anxiety. As you can imagine, the experience of failing is anxiety producing, but so, and this is interesting, so is the experience of success. It may surprise you to realize that someone who just had a successful moment maybe experience anxiety, but that's the case. And why is that the case? Because most of us have the fear that success will continue. We have the worry that this is just a moment of success, maybe an aberration, and that failure is coming. Sometimes called imposter syndrome, Maybe the world thinks we're an expert at something, but we secretly worry that we aren't. So you may find it surprising that a client who's just had a big success is also manifesting anxiety, but you shouldn't really be surprised, because with failure comes anxiety, but with success also comes anxiety. Any parent knows that we are made anxious by what's going on with our kids, whether it's them falling off a structure on the playground or staying out late at night if they're adolescents. If we care about someone, then we are made anxious by their behaviors. This is an odd but natural result of evolution, is that we should see attachment and caring as dangerous. But it makes perfect sense why we would. If there's somebody in our charge, if there's somebody we love, if there's somebody we're taking care of, then their well-being makes us anxious. And if the world criticizes us, that makes us anxious. But if the world says nothing at all, if we only get silence from our efforts, if you're a creative person and you send out a query email about your novel to 20 literary agents and you get only silence back, you're going to be highly anxious, wondering, do they hate my novel? Will they ever reply to me? What's going on? So even if nothing in particular seems to be going on in your client's life to make her anxious, she may be waiting on something, hoping for something to happen. Waiting is like silence. Waiting is one of those things that makes us anxious. And so with all of these sources of anxiety, we could have named more. I'm sure the headline you got from what I was just saying is that there are lots of reasons why human beings get anxious, lots of normal, everyday reasons. And so on the one hand, it would be good to know a particular source of your anxiety or your client's anxiety. If it was a change in circumstances, that would be good to know. If it's because a big decision is coming and the choosing is making her anxious, that would be good to know. So basic inquiring about the source of your client's anxiety is a good thing to do, that kind of inquiry. But even if you can't ascertain, even if you can't determine the source of the anxiety, you can still help your client. Even if you don't know the source, you can provide your client with anxiety management tools. So let's go through some of them. First, here's a study of anxiety. Help them stop fighting with the idea that they're not supposed to be anxious. Kind of laugh with your client. Of course you get anxious. We all get anxious. Anxiety is not a symptom of a mental disorder. It's something that we all experience. You want to acknowledge your own anxiety, maybe even sitting across from your client, and acknowledge all human anxiety. You want to, with your client, honestly investigate the sources of anxiety. And you want to help your client begin to practice calmness, maybe even raise that to the level of one of her life purposes. Invite her as one of her life purposes that she's going to be a calmer person from here on in. You and your client, you're going to, for your own sake, acquire some anxiety management tools, but you're also going to invite your client to acquire some of these tools. And last but not least, You want your client to live her life purposes. You want her to identify them, to know what's important, and then to live them, because the act of living our life purposes reduces our experience of anxiety. And now for some anxiety management tools that you can share with your clients. Simplest one is deep breathing, been known for thousands of years as a good thing. 5 seconds on the inhale, 5 seconds on the inhale. You can do a little deep breathing with your client in session. You can model it. There's elaborate breathing techniques, but I don't think you need to teach clients elaborate techniques. Just remind them to breathe. Very simple and very useful. You want to invite clients to think thoughts that serve them. If they are thinking thoughts that make them anxious, you want them to dispute those thoughts, say, nope, I don't want you, thought, and to think a more useful thought instead. This, of course, is the core idea of cognitive therapy, that thoughts harm us, that our own thoughts harm us. In my book, Redesign Your Mind, which we chatted about in a different webinar, I propose the idea that not only can you change your thinking, but you can change the source of your thinking by envisioning your mind as a room and then actually redesigning it and redecorating it so that new thoughts arise in that room. So this is a big subject, but the headline is you can invite your client to reduce her experience of anxiety by encouraging her to think thoughts that calm her rather than thoughts that make her anxious. And you can marry those two ideas of deep breathing and right thinking into a little device that I call an incantation. It's really just a thought dropped into a breath. I did a book on this subject called 10 Zen Seconds, and the 10 of that title is a long breath, 5 seconds on the inhale, 5 seconds on the exhale. And the kind of thought that you might invite a client to think and breathe might be, I'm perfectly calm. In canting, I'm perfectly on the inhale and calm on the exhale. It's a very simple device to use a breath as a container for a thought, but it's a very useful device. You can invite your client to visualize different aspects of calmness, maybe create a calmness visualization or ritual. One visualization that I suggest to clients is that they imagine that there's a calmness switch somewhere in them, and when they're feeling anxious, they can just flip the switch and instantly grow calmer. Obviously, this is a metaphor. There is no switch to find inside of yourself, but it's a useful visualization. It's a useful metaphor. And many clients not only understand this well, but they find that they can do this rather easily. They can adopt this idea of flipping a calmness switch. There are all kinds of physical tactics for releasing anxiety. The simplest is to get up and walk around. Often we get stuck in one place on our sofa or in front of our computer screen, and we have the experience of what's called inhibited flight. We feel trapped there without even knowing it. That's the experience we have on airplanes often, is that we're trapped in that little seat, and that increases our experience of anxiety. That's part of the fear of flying, is being trapped in that little seat. So one of the important things we can try to do is just get up and move. Movement reduces anxiety. There's a category of anxiety management called discharge techniques. That's getting the anxiety out of us. One way to do it, as this fellow is doing, is to silently scream. Ah! Make a big screamy face, because that will allow anxiety to escape. And there are many other kinds of discharge techniques. Actors and other performers often learn these as part of their training programs. Of course, historically, folks have engaged in all kinds of ceremonies and rituals to reduce their experience of anxiety. Probably the best known and most often used is just lighting a candle, meditating for a bit, breathing a bit, setting up a scenario where you reduce your experience of anxiety through ceremony and through ritual. Creating useful cognitions, we call them affirmations. They can come out of one's philosophical or religious tradition. But having one or two go-to affirmations can make a big difference. If you try to have a long list of cognitions that you're supposed to remember, nobody can remember a long list. But if you have one or two that you know to go to, like right here, right now, meaning I'm going to be present here and not worry about the past or the future. Or I'm perfectly calm. Just a set of 2 or 3 or 4 words that we know to go to reduce our experience of anxiety. This idea of disidentification is very much like detachment in Buddhism, and it comes from the branch of psychology known as psychosynthesis, founded by the Italian Assagioli. And it's the idea that we are not our temporal experiences. We are not what we are feeling. A feeling is just passing through us. If something is making us anxious, that will pass. That we have a central core that is perfect and wonderful and can't be made anxious. That is, we are disidentifying from our temporal experiences, from our moment-to-moment experiences, and reminding ourselves that all of that comes and goes, and what's left is a central, powerful, wonderful core. If something in our field of view is making us anxious, one technique for reducing our experience of anxiety is to turn away from that. If you're waiting for a phone call and you know that the phone call is going to be a difficult one and that it's making you anxious, don't have your phone in your field of vision. If you don't want to be made anxious by the clutter in your storeroom, close the door. That doesn't get the storeroom organized, but it will reduce your experience of anxiety. So the headline here is we can turn away from the stimulus that's making us anxious by turning towards some neutral stimulus that won't make us anxious. One of the important ways to reduce our experience of anxiety is to come back around to the belief that we matter and that our efforts matter. To the extent that we are doubting that we matter, that keeps us jittery, and we don't know why we're here or what we're doing. That's core existential anxiety, not knowing what to do next because we don't know why we're here or what we're doing. So the solution there, the tactic there, is to patiently identify what's important to you, your life purposes, and then find the way to actually live them. In order to feel less anxious, we may need to do some healing and self-care around old traumas or ongoing traumas. For instance, in my work with authoritarians in the family, authoritarian wounding, which is one of my areas of interest, what I've discovered is about the only thing that really helps an adult child deal with a bullying parent is moving far away from that parent. Physically getting distance. So for somebody, for a client, one of her self-care maneuvers may be to move because she needs to get away from her bullying parents. In my language, I believe that all of us could use a personality upgrade. That is, that there are aspects of our personality that we would like to be different or better. If you'll remember the model of original personality, formed personality, and available personality, the idea is that we enlist our available personality to make changes to our formed personality according to who we want to be. For instance, maybe we know that we're operating from a little bit too fearful a place in life and that we had better take more risks if we want to accomplish what we want to accomplish in life. So that may be the personality upgrade that we announce for ourselves, that we're going to take a risk. And of course, taking that risk is going to make us feel anxious. The risk is not an anxiety reduction maneuver, but having successfully accomplished the risk will reduce our anxiety the next time we want to take a risk. We'll feel more daring, bolder, by virtue of having taken that risk. Obviously, many things support calmness and many things don't support calmness. To take a simple example, let's say there's construction at the front of your house and that's where you sleep. Start sleeping in the back of your house. That construction is going to keep you awake. The insomnia is going to make you more anxious, etc. This is what I'm saying is obvious, and yet people often will not make simple lifestyle changes that would support calmness and that would reduce their experience of anxiety. And in session, this often feels like something too small to talk about, but it isn't too small to talk about because there may be some small change. For instance, if you have kids and a new kid comes along and now two children have to share a room, that's likely going to make the older child anxious. This is a new experience for the older child. And so that is something for the parents to think about. Is there a way for the children to still stay in separate rooms? Or if they must be together, is there something we can do for the older child to make him or her feel less anxious in that experience? So these day-to-day, in-the-house experiences are very much worth investigating and talking about in session. Many people are not going to reduce their experience of anxiety until they change their circumstances. If you're in a difficult relationship and you kind of know that you are going to get divorced eventually, but you're not ready to do that yet, then probably every day you're having an anxious experience in that relationship. And what's going to ultimately reduce your experience of anxiety is finally getting that divorce and moving on with your life. There may be really no way to reduce your experience of anxiety if you're still in a relationship with a bullying mate, and every time you enter the room where he is, you're scared. Well, that fear is not going to go away while you're still in that relationship. You need to change those circumstances. You want to create and then do confidence-building experiences, because as we mentioned earlier, a lack of confidence creates anxiety, and the antidote to that is to actually feel more confident by trying some things out and being successful at them. As I mentioned before, if you are in inner or outer conflict, that produces anxiety. Outer conflict may be conflict with a coworker, conflict with your mate, conflict with a parent. All of those conflicts produce anxiety, and you need to somehow, as best you can, try to resolve those conflicts to reduce the experience of anxiety. And some conflicts are inner conflicts. For instance, in my work with creative and performing artists, I'll often encounter a musician who's now a professional musician, mainly because her parents wanted her to be a musician, rather than because she herself wants to be a musician. That's an inner conflict between pleasing her parents and wanting to do something else. And until that conflict can get resolved, her typically performance anxiety will not resolve itself. She's having severe performance anxiety because she's still conflicted about being a musician, and that has to get resolved. For many things in life, we are anxious because we don't feel prepared. And so preparation is a key anxiety management tool in many circumstances. For instance, in my world, if you are about to have a meeting, if you're a novelist and you're about to have a meeting with a literary agent for the first time, that's going to make you highly anxious. And the way you would prepare is by trying to identify the natural questions that she may ask you. There are only about a dozen, and preparing answers to those questions, just as you would for any kind of job interview. It is clear that the better you prepare for something like a job interview, the more likely you are to go in there less anxious. There are all kinds of behavioral changes that will make you less anxious over time. We know what they are. Not smoking cigarettes, not alcoholically drinking, not obsessively shopping. There are all sorts of soothing activities that connect to our attempts to reduce our experience of anxiety that don't actually reduce our experience of anxiety. All they do is demand the next cigarette and the next drink and the next shopping spree. They don't do anything to actually deal with the anxiety. And then I think a big one is what I believe is actually a choice. Many people have chosen to live a kind of dramatic, histrionic life. They like the drama. They like staying agitated. And so you can wonder aloud with a client, might it not be a good idea to change your attitude and opt for a calmer life? Decide that you want to live calmly rather than dramatically. And in my experience, clients understand what you're asking of them, what you're telling them, and they will give that some thought, and that can actually make a big difference. They may be able to actually make the decision to become a calmer person. So, in summary, expect your clients to be anxious. You don't have to start going down some diagnosing path because your client is anxious. These are not symptoms of a mental disorder. These are natural anxiety reactions to life. Actually, number two, be a little curious if your client isn't anxious. I would be wondering to myself, what is this front, this confidence front really masking? Because I believe we're all anxious somewhere inside of ourselves. When your client is presenting any kind of issue, just wonder in your own mind, is anxiety part of what's going on here? And if you think it is, bring it up. Wonder aloud. You know, what you're telling me, I wonder if there's some anxiety going on here also. And then inquire of your client, do you have some anxiety management tools that work for you? What do you do when you're anxious? And your client will laugh and say, I drink. Or your client will provide you with those anxiety management tools that he or she knows aren't good ones. And so that becomes an invitation to teach your client one or two anxiety management tools. Something very simple, like the breathing and thinking bundle idea, the incantation idea, that's very useful, or visualizing a calmness switch, some very simple ideas. And then I think it's useful if you give homework or if you set goals with clients, to give your client something to try that tests her anxiety management tool, her new anxiety management tools. Give her a way to practice the anxiety management tool so that it becomes more real and more useful. So that is the end of our chat around anxiety, and actually the end of our series of webinars. Please do be in touch with me. I hope you'll be in touch with me either by dropping me an email to the email address that is there. If you're interested in this subject of anxiety, I would recommend my book called Mastering Creative Anxiety, in which I go over many of these anxiety management tools. And please do subscribe to my newsletter. You'll see the way to do that on this screen. And if you don't get this screen after a moment, just visit my site, ericmaisel.com, and you'll see the place to grab my newsletter. Okay, let me take a moment to close the PowerPoint and figure out how to hand the webinar back to the host. So thank you, and give me a moment here.
Tell. The topic was very interesting. So, are there any questions? There are no questions
Great.
yet. That's good.
I think I'm supposed to close the Skype, so let me close the Skype.
Okay.
Okay. You still here? Yes.
Yes. Yes.
Okay, good. Yes. If there aren't questions, I just want to thank everybody for their attention. Whoa.
There is something in the middle screen, but unfortunately, I cannot read it.
When I certainly can't.
Yeah, definitely. But so there is a comment here. Is that by Maria Cotti, right? I will read it. I will go through.
Okay.
A participant says that she's wondering how we approach patients who after the session have all the willing in the world to do something creative, such as painting, as you mentioned, but actually this feeling lasts only for a short period of time. So how do we tackle with it?
The main help is to invite a client to start very small. And the number I usually choose is 20 minutes. That is, I would invite a client who either has never been particularly creative and now wants to be, or is creative but is blocked or stuck. to try instituting a daily 20-minute creativity practice, we would need to get the project named, because if it stays unnamed, then it's very hard to work on. So it would be a sort of two-step process with a patient or a client, and that is, what is it that you'd like to be actually working on as a creative project, and are you willing to try getting to it for 20 minutes each day? The idea is to not make it seem too large to begin with, because large is going to equal anxiety in a client's mind. The main tactic is to start small.
Okay, thank you. Is there another question or a statement? The topic was very interesting, and we heard very interesting things regarding anxiety, tips for to tackle anxiety. So I think
Yeah, thank you. I'm glad to have been here, and I wish you a good evening.
same to you. So shall we wait for 1-2 minutes, and then we can close the link if there is
Okay.
another question? Um, there are some more comments saying that they found the seminar really interesting, and it was truly
Good.
marvelous.
Good.
So
Okay. I
I
think I will take
think we
that.
are, yeah, I think we
That's
are
right. I think,
done.
and
Thank you very
I
much.
hope you're very welcome, and have a wonderful evening.
Same to you. And it was really nice to meet you.
Good meeting you. Bye for now.
Bye bye. Thank you.